Hi, everybody. Good morning. Aloha kakayaka. I appreciate the platform to present today. Let me start to get there. Okay, great. Okay, so a little roadmap for my discussion today. I'm going to go a little bit into like who our regional Pacific Islander Task Force even is. It's a long organizational name, so I was going to go into kind of who we are, how we're structured. Who do we serve kind of in terms of a community health, public health population in the Northern California context? And then kind of a little bit on what our task force does. I'll try to be quick on that to then jump into the lessons learned during this mini grant program that task force was part of during the 2023 to 2024 year. And then I'll end with Q&A if anyone has anything. Okay, let me move our heads here. Okay. So who are the Regional Pacific Islander Task Force? I like to think of us as like a public health advocacy organization, but we were started in 2015 really to address a lack of data for Pacific Islander health, or what is called NHPI, Native Hawaiian and Pacific Islander health in the United States. And really across the Bay Area was kind of the focus at the time in 2015 because there was a lack of data around our health in San Francisco, Alameda, and San Mateo counties. And so originally we kind of convened Department of Public Health leaders in those three counties to really discuss that and raise awareness about that. And just over the years, I mean, that work kind of started before the pandemic, but it really kind of geared us and oriented us to do a lot of pandemic response and involve really all 10 Bay Area counties over time to really address the issue of lack of data and visibility of NHPIs, especially around TB, but as well as like chronic disease like cancer, diabetes, heart disease, and hypertension. Okay, a little background of our org. I just went over that, yeah, we were founded in 2015, really to convene multiple Bay Area County Department of Public Health leaders, as well as our org leaders in the Pacific Islander community that lead different organizations in the Northern California Bay Area. And then also infusing very clear public health perspectives like understanding social determinants of health, as well as like life course perspective, understanding intergenerational health, and the importance of like mothers and healthy birth, and trying to alleviate maternal stress for like good birth outcomes and things like that. A little bit about the different Pacific Islander orgs that kind of formed to create Regional Pacific Islander Task Force. It's all the leaders and executive directors of these different Pacific Islander programs in the Bay Area: Kalama for Tongans, Samoan Community Development Center, and Pacific Islander Wellness Initiative and Mental Health Program here in Alameda County. All these leaders of these different organizations kind of are the backbone of our organization in terms of like leadership framing. They've worked with my leader, Tau Nu'uve'e, and Pacific Islander Wellness Initiative's leader, Natalie Asun, to really form task force. And then this is our staff. We have a small but mighty team of 6 right now, and actually we just hired a 7th, but I didn't get our picture for this slide, but yeah, we have a full team of Pacific Islander community members doing Pacific Islander public health advocacy work. And then in terms of our population, we focus on NHPI. And recently there was a change in the OMB, or Office of Management and Budget, on kind of the ways we are counted as a community. And so we're moving forward, we're going to start to disaggregate the 6 major subgroups under each population as a kind of norm across every racial and ethnic group. So we often think data disaggregation only impacts Asian and Pacific Islander communities, but it really is relevant for every racial and ethnic minority group in the US context. Yeah. And then, so a little bit of background, how many of us live in the US context? Really, it's 1.5 million, combining alone, so just NHPI alone, as well as NHPI in combination with another group. For example, like I'm Native Hawaiian, but I also identify as Filipino. So I would be counted if you also include in combination with another race. Yeah, so just some context. But for me specifically, like zooming down, my project really focused on Sonoma County. So this is kind of Bay Area population counts by county, and I focused on Sonoma County really to drill in to work specifically with the Melanesian Pacific Islander community, the subgroup being Fijian community members. And my leader wanted me to orient the project towards Fijian community members to try to devote a lot of our outreach dollars through the T program to Fijian community around tuberculosis outreach and education. And then, yeah, it's just a little slide to kind of go over that Pacific Islanders or NHPI are broken up into three major geographical groups, Polynesia, Micronesia, and Melanesia. And so we kind of, we're very diverse. There's a lot of different subgroups within each of these major groups that make up NHPI. And I just wanted to kind of reflect that we're very diverse, even though we're very small in terms of population size. A little bit about who those different groups are. Just for context, I worked specifically with the Fijian community, which is a subgroup of Melanesia. So I just wanted to kind of be clear about that was the community that I was focusing on for this T project. Oops, sorry, wrong way. And then I might be able to send the slide deck to Dia if anyone wants, but there's more information on just exploring the different Pacific Islander communities I put into the slide deck. I really like a reference map created by Empowering Pacific Islander Communities, really going into the different citizenship statuses that our community have in this fabric of the United States. Some Pacific Islander groups are considered US nationals, some are considered US citizens. And so we have a different and complex web of access to different health and social programs that it's just good to understand that context and that layered on top of Pacific Islander health. And then just to dive into what our public health work looks like. Task Force, we have all these different approaches for how we think about public health and what we like to focus on. And then population health, that in that area, we like to focus on infectious disease control, such as HIV, COVID-19, as well as TB, but also other diseases like cancer, heart disease, and that kind of thing. We have multiple approaches to that, how we do that work. We, of course, like to elevate Pacific Islander health and social issues, and we do that by really advocating for disaggregated data, number two. And we like to advocate with different institutions, different laws and policies in California state context that really focus on shining light on our health disparities. And then we also like to unify our community around action, educating community just about the lack of our data and the importance of our data, as well as just leading on a community level some positive change. And then these data are county level provided from Alameda County, and it really just, their epidemiology team recently shared a lot of data with us from the Alameda County level, but I couldn't pull any Sonoma County data, unfortunately, for this, but this just shows like our health disparities as Asian and Pacific Islander communities with regards to TB. And then now this finally gets me to my three like learning lessons from just the mini grant program and our impact. So the first one is really just, it's vital to meet community partners who help in our outreach to come to our health fairs and our screening events. It really helps to meet them where they're at and when they're at. So a lot of the time, we couldn't really convene virtually or physically. So we had to meet virtually. And the only time that worked for a lot of the community members was like at 8 p.m. to 9 p.m. And so, you know, I had to kind of be a little flexible here because I wanted to be available when the community is available. Kind of acknowledging that our community outreach partners in the Fijian community for this project are doing this kind of as a side thing. That's not their primary job. They're faith leaders, they're caregivers, and so I was just trying to be flexible. And I think that's important in community health work, is to kind of be flexible around communities' capacity to support public health initiatives. And then another important factor to our work, we actually had a second annual health fair event hosted in Petaluma. And in Sonoma County, there's a lot of Fijian community members living there, as well as in Sacramento. And in California state, there's a lot of Fijians nationally. So that's kind of why we wanted to focus in Sonoma County and Petaluma. And in that work and planning for our second annual health fair event, we wanted there to, of course, be a TB element. So a little bit on navigating people to get screened at a nearby federally qualified health center. But also, when I was meeting with the Fijian community leaders virtually, they were saying that they need support on Medi-Cal enrollment. They need support on chronic diseases as well, not just TB. And then we kind of had to navigate, wanting to achieve all these different aspects of public health that wasn't just in infectious disease area alone. So in our health fair, we ended up bringing together partners to also talk about colorectal cancer, and also supporting UCSF Helen Diller Family Comprehensive Center, Comprehensive Cancer Center at translating Vakaviti colorectal cancer materials, and then having real faces. So the two community members in the middle, Una as well as Doreen, they're two of the Fijian community leaders that I met with to plan for this health fair and other matters. But their image was also, we were able to do a consent form and give it to UCSF for sake of adding their real faces into Fijian outreach materials for cancer. So we tried to achieve other things other than just TB health education and care connection. And also at the time, beyond cancer, at the health fair, we also pushed our blood pressure self-management health education program into the health fair itself. So the two images on the outer are images in Alameda County. We were trained from the nutrition department on doing blood pressure screenings. And it was nice because it followed us also getting trained in late November last year on American Heart Association Check Change Control evidence-based program. So to really just support community and knowing their blood pressure numbers. And we worked with Kaiser Permanente in like the Petaluma area to kind of purchase blood pressure monitors and to give it out to Fijian community members also at the event with screened high blood pressure. I think we had like about 20, and I think Kaiser Permanente, they actually had to run to go purchase more. And then we ultimately, I think, gave around 26 that day and had a total of like around 65 attendees of the event. And then the third thing is really just to make sure that, in any sort of public health event, we want it to be attended, right? In doing so, we want to make it relevant to our community. So we really want to focus on making it family-centered, culturally relevant, and fun. So a lot of our faith-based leaders that met with us, they provided free food to really encourage people to come and get screened and to discuss tuberculosis and other health screenings that were at the event. As well as like participating lay making. We worked with Lelua here from SF Hep B Free. They lead a program called Under the Mango Tree, where they kind of infuse Pacific Islander culture and lay making with blood draw and hepatitis screening. I asked them, and I wish we could have done like blood TB screening, but we just weren't able to do that. Like the laboratory they sent it to couldn't do both. But anyway, just things like that really encourage our community to engage around public health and feel at ease when they're doing so. And then, yeah, we also had raffles and giveaways. I worked with the Pacific Islander Wellness Initiative program because of my leader, Natalie. And then she let me know that the logo, they just rebranded recently. It was actually designed by a Fijian community member. So it was really nice to kind of just tell the community that we were giving away a lot of these free Pacific Islander Wellness Initiative bags. And a lot of the community members, when they heard that it was a Fijian who designed the logo, they loved it. They like all wanted one. And we had so many to give away. So it was just really nice to kind of come with something that was relevant for community. And yeah, it was also nice to advocate with a lot of other grantees in Washington, D.C. And then our work also with other national leaders in the Pacific Islander community. And then I'll just end there. I hope I covered a lot of land, and I appreciate everyone for listening to my presentation. If anyone has any follow-up questions, let me know.